Hi, I'm Dr. Mickey Frame, chiropractic physician and acupuncturist here at Falcon Health Center. One of the misconceptions with acupuncture is that acupuncture is painful because we utilize needles to stimulate various meridian points. What I like to explain and kind of get rid of that misconception is that the pain from an acupuncture needle is very similar to when you pull out a hair, which is very minimal. In many cases, we can also stimulate an acupuncture point using pressure points or sometimes light therapy if a patient is that fearful of a needle. So there are other ways we can treat with acupuncture other than a needle if we need to. Some of the most common conditions I treat with acupuncture is back pain, neck pain, chronic migraine headaches. Plantar fasciitis is a good one. Shoulder pain, knee pain. I see a lot of patients who have had failed back surgery syndrome or failed shoulder surgery syndrome, and the acupuncture can help with their pain. We utilize battlefield acupuncture, which is used in the military. They don't have morphine to treat a patient who maybe has lost a limb or been shot. They found it very effective in treatment for the pain to at least control their pain until they could be evacuated to a hospital. We utilize battlefield acupuncture points, which are many points, 5 or 6 points in the ear that we stimulate that help control patients' pain. And in many cases, when they walk in at a pain level of 8, they may walk out with a pain level of 4. So we're able to reduce the pain level in patients in a short period of time, in many cases about 50%. A misconception with acupuncture is it's only for pain. And although pain is one of the most common things I see and treat for acupuncture, acupuncture can be used for a variety of conditions. Other conditions I've treated collaboratively with some of the primary care physicians here at Falcon Health include neuropathy, which is numbness, tingling in the lower extremity in many cases, sometimes related to diabetes, sometimes just related to old injuries. We've done some collaboration between the primary care with the medical management and the acupuncture, and we've had some good success with treatment of some of the neuropathy patients. I also use acupuncture beads with the Falcon Health Challenge for the weight loss that we utilize, so it helps to suppress the sugar cravings or suppress patients' appetite. One of the other conditions that we tend to treat that I talked about earlier is migraine headaches. Been very successful in the treatment of migraine headaches for those patients who've had chronic migraines who want to try to get off some of their medication. Again, we try to collaborate with the primary care physician, the neurologist, in many cases to try to wean them off their meds and see if the acupuncture can be long-lasting and effective. Acupuncture has been around for a long time, since 300 BC, which is way before I was around. So it's been very effective. It's been more accepted now in traditional medicine, and here at Falcon Health Center with the collaborative care that we're doing between the chiropractic, acupuncture, medicine, and physical therapy, it's been very successful in treatment of many patients with chronic pain.